Tech 101. I'm Grant Black, Director of Technology for St. Tammany Parish Government. Our goal is to ensure that our citizens grow in their digital literacy. Today on Tammany Tech, we talk to Jordan Hubbard, IT Director for Slidell Memorial Hospital. Welcome, Jordan.
Hey, thanks.
So, how did you get into IT?
Sure. So I actually started my work career, professional career in the Navy. Worked on a bunch of proprietary electronic systems, and then from there got out of the Navy. I was selling insurance for a little bit, and kind of got bored with that, and found myself in a help desk position at the Christian Broadcasting Network, and kind of developed myself from there, moving into engineering and moving on to eventually leadership, and got this job at Slidell Memorial as the Director of IT for. Been doing that for a couple of years now.
So with the Navy, was it more networking or operating systems? What was your focus?
Sure. So that was primarily intelligence. So it was electronic intelligence. So that's all your radio frequencies and radars and all the things that go into that, and threat intelligence and figuring out, as we're moving through the water, what are those other ships around us? Is that a fishing vessel? Is that a Russian spy ship? What is it?
Sure.
So that was my job, and we were working on equipment that was probably from the 1970s. So we're pulling circuit cards out of bread baskets and different things like that.
So literally from looking at trying to identify watercraft and over to I guess help desk,
mm-hmm.
And then now how did that prepare you for IT director at a hospital?
I would say that the preparedness for anything is probably what helped me more than anything. Being able to kind of move with the wind, as they say.
Sure.
So as things arise, just being able to respond with a calm mind is one of the biggest parts.
At one point, I was interviewing people for a job, and a former Navy SEAL applied, and he interviewed. He did good, but he wasn't, I guess, the most technical candidate. And we got to the end, and I'm like, yeah, I want to bring him in. And my team was like, well, he wasn't as good as this person. I said, that guy has been dropped into the middle of nowhere and gotten things working. We were in the middle of deploying something that was fairly complex. We were going into the cloud, the initial kind of push into the cloud for the Department of Defense. And it was funny. He came in and was lights out with everything. Nothing fazed him. Like, he never broke a sweat.
Yeah.
So I think it's good to have that military background sometimes.
Definitely.
So you've also just started a charity
mm-hmm.
that you're now president of, mm-hmm. right? Do you want to talk a little bit about kids?
Yeah. So kids. That's Kids in Development. Slidell is what the acronym stands for. Kids. And we purchase and provide car seats through other nonprofit organizations that do our vetting. So that's two that come to mind is the Good Samaritans and the Crisis Pregnancy Center. Mm-hmm. So they kind of know which families need a car seat that may not be able to afford one. So we purchase those car seats, and then we get the car seats to a certified installer. The certified installer provides them with 2 hours of training on how to install it properly, and then they get a car seat at the end of that. Nice. So it's definitely a need. I think the St. Tammany Parish Sheriff's Office did something years back, and mm-hmm. that program discontinued, so we saw that need and decided to fill it with our own nonprofit organization.
That's cool. Yeah, so I think the Sheriff's Office gave seats out, and the fire department at one point would help you install the seats. Mm-hmm. So you kind of put it all together, and then if someone wants a car seat, where do they go?
Yeah, so they would go to one of our partner NPOs, which is Good Sam's and the Crisis Pregnancy Center are two of our main ones. There's one other I just can't remember.
Is the Corner still part of that or no?
No, Corner does a great program with their cribs for kids,
yeah.
but no, we're not partnering with them this time. Yeah.
Nice work on that.
Yeah, I appreciate it.
All right, so back to Slidell Memorial and in your role there, you guys have a new building coming up that you're putting in place?
Yeah, so we're putting a new tower in, a new 3-story tower that's going right behind the hospital on Florida Drive, and that's going to have our new OR in it, our new operating rooms, kind of state-of-the-art stuff that we're putting in there. They're going to have like our med surge or nursing units, and then our ICU is going to expand in there as well.
So the old ORs that we have in place have been there forever.
Yes.
Small. Basically,
Yeah.
not large enough for today's standards.
Yeah, they're small, so the new ORs are going to be quite a bit larger, and we're also putting just all kinds of brand new tech in there as well.
So what you putting in? Let's hear it.
Yeah, so just brand new booms. So those are the arms that kind of swing around the table for anesthesia, for a lot of different things that the doctors use for endoscopy and different things like that. So we're putting all this new tech in there, and currently, like in our ORs at SMH East or Slidell Memorial Hospital East, we're even doing like robotic surgeries, which cuts down on recovery times, and it also provides for less intrusive surgery where needed for like orthopedics and different things like that. So I mean, we're cutting edge now, and yeah, our current operating rooms at SMH Main are a little bit older, but we're getting on the same page with SMH East in the new ORs, so it's going to be great.
So when you get these new ORs in place, I mean, are doctors, is it going to help you recruit doctors, bring new people in, or retain what you have?
Yeah, absolutely. I mean, we've got a great cardiology program as it stands right now, and orthopedics and all manner of things. But it absolutely helps, recruit younger doctors and the like because of the new tech, and helps our programs grow for sure.
Sure. All right, so let's talk about telemedicine. So
Yeah.
Does that run through the hospital? Is that something that your team can assist with, or how does that work?
Yeah, so we've got, we call them telecarts. So we've got our telestroke and telepsych carts. And that allows, it's basically almost like an iPad that sits up on a stand that they can wheel into the room. And for like a stroke patient, for example, it brings on a stroke certified physician right onto the screen, and they are able to kind of zoom in and see symptoms, talk through, and ask the questions on what symptoms are you experiencing, and it helps diagnose and quickly treat stroke victims, which is absolutely life-saving because time is of the essence with strokes, especially.
So they get alerted based on I guess what's plugged into them.
Yes.
The nurse station gets alerted, and they can come right in with the telestroke.
Yeah. They'll triage patients kind of through our emergency department, and if they've got a lot of training and certifications around stroke, so if they see some of those early signs, numbness, lapse in face, and
Sure.
speech and that kind of thing, they can very quickly grab that cart, bring it in, and start that diagnosis.
Well, it's nice. I mean, is that coming to East Campus, or we have it now?
That's currently at both campuses, SMH East and Main. But what we're putting into the new building for like our ICU that's going in there, our med-surg units, is Epic Monitor. So Epic Monitor actually gives them the ability. It's two things really. It's a digital nurse board, so they can put up their your nutrition information, that you're allergic to shellfish or whatever the case may be, and they can put that stuff. I'm Nurse Sue, and this is your treatment plan of the day. And then it also allows them the ability to kind of drop into the room. They've got cameras, a TV screen, and a computer that works with all of that. And they're able to drop into the room and do kind of a face-to-face, almost like a Zoom call or a FaceTime call with the patient. And the camera is sophisticated enough that it can actually zoom in and look at like their O2 and heart rate and different things like that on the monitor within the room. So that helps a number of things. That helps them during codes, unfortunately, when a patient's coding. You have a lot of nurses that come in and respond, respiratory therapists, all manner of people that come in to respond to help save that patient. And then the person sitting on the other end of the screen for that Epic Monitor can help chart and keep track of time of medicine administered and time of different things. So it's huge.
You said in the ICU there's potential multiple codes at the same time.
Yeah. Yeah.
So I guess we could assist with that as well.
Yeah, I was talking to one of the nurses over at SMH East, and she was kind of really advocating for the ability to have that.
My father-in-law, he had a heart attack, and he got pushed out to Jefferson campus. My wife would go out there and stay with him. When I went to visit one day, and I saw they had the monitor in the room, so you had the TV, and the nurse could see him. He could talk to the nurse. She could ask him questions, see where he was. So it was really cool to see that technology. But I think it's even nicer to see it on the North Shore.
Yeah.
So to bring it in, I've heard people complain. Well, all the investments on the Jefferson campus, but clearly that's not true. There's a lot of investment coming in.
Absolutely. We went to the community and we asked for a millage for the hospital to build the new tower. And my boss, Holly Sanchez, made a commitment that she wanted to do state-of-the-art where possible throughout the hospital. So, we're obviously being good stewards of the money and making sure that we're purchasing smartly, but we're trying to make sure that it's future-proof as much as possible as it relates to technology. So
it's difficult to stay on the edge of that curve, not be bleeding edge, but
Right.
but have the technology you need. Because clearly, you need the technology to save more lives. So it's a balance that I guess is just hard for you guys to kind of navigate through.
Yeah, it can be difficult, but we've got a lot of really smart people on staff that are making it possible. So.
Yeah. So from an IT crew, your staff, how is a hospital different from a normal IT crew?
I'd say that your standard IT shop, it's very similar. So we've got a help desk that kind of are our first responders. They take the trouble calls. We've got our sysadmins that can help with tier 2, tier 3 type workflow. We've got our engineers, our networking and systems engineers that can do project work and build new servers and that kind of stuff. And then we've got like our application side. And I think that's probably where it differs a little bit, where a lot of IT shops may have an applications team that does like application development, writing programs and different things like that. We do have a little bit of that, but a lot of what they do relates to the actual patient-facing applications and the nursing-facing applications, and helping them bridge the gap between practicing medicine and performing it with the technology that we have in place. So.
Makes sense. So we're going to take a break, and when we come back, we'll continue talking with Jordan, probably going to a little bit of my chart.
We have world-class amenities with a small-town vibe.
What I love about the North Shore is the people, they're friendly.
How you doing? A good handshake, just genuine.
Well, I like the family-oriented environment that it provides. I love all the things that families can do.
I'll point right out here, the lakefront. It's one of the crown jewels of St. Tammany.
The food's incredible. For how small of a town it is, it really will blow your mind how good the food is.
I love the openness, the space.
Spacious.
Space.
The nature here is a really wonderful thing to experience, all of the excursions that you can take part of.
This area, it sells itself. It is absolutely beautiful, as you can see. So that's why we're doing an interview right here.
Shopping.
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 The arts community is growing, and
Go to Brooks Bike Shop, rent some bikes, and take off.
I've lived all over the world, and I always keep coming back because it's home.
Great hotels,
There's tons of free concerts that go on all the time.
bed and breakfast.
Great festivals and community events that draw people into our parish.
It's easy. It's easy and relaxing.
Gemütlichkeit. It's just like all around being happy.
I guess life just slows down a little bit more. And look at this river. It's gorgeous.
We love our Louisiana North Shore.
We love our Louisiana North Shore.
We love our Louisiana North Shore.
We love
Our Louisiana
North Shore.
And we're back with Jordan Hubbard from Slidell Memorial Hospital, the IT director. So when we left, I kind of teased a little bit. We were going to talk about my chart. So we all have, well, most people here have my chart. I think we've seen some basic features of it, like appointments and those things. What's some things about my chart we may not know, or some tips and tricks?
Sure. So to get into my chart, just a little bit of history on that. Slidell Memorial Hospital implemented Epic in 2018. We started with some clinics, and then we moved into the more inpatient side of the hospital. And it was a conversion process of our electronic medical record, or EMR. And I mean, that was huge because so many different hospitals and so many different care areas are using Epic. And what that means for the patient is, wherever Epic is used, wherever you go, you're getting continuity of care. You're getting the ability of that physician that's treating you for that heart attack in Florida to be able to see, okay, he had a history of this. He's taking, stress relieving medicine, or he's taking
you can see all your
blood
drugs.
pressure medicine. They can see all of that. So you're getting that continuity of care, and that's huge. My chart is a personal application that you can install on iOS or Android that allows you the ability to see test results from labs. It allows you to see the results or the notes from a physician on a particular diagnosis or a particular treatment plan that he's implementing for you, he or she is implementing for you. And it allows you, especially if you're a caregiver for children, so my chart for being able to see your kids' charts and see when things come back. So a lot of times you go in to the hospital, you get labs done, they'll draw blood or whatever the case may be, and then you may not see those results until you come back for a follow-up appointment 3 weeks later. Well, with my chart, if those test results take 3 days to get into Epic, now you can see those 3 days later, as opposed to waiting 3 weeks to see those results. Obviously, it's still recommended that you let a physician interpret those results and talk to you about those, rather than making your own assumptions or going to WebMD.
Dr. Google?
Yeah, Dr. Google. But it at least gives you a little bit of peace of mind on.
See, also you get notifications. That was one of the cool things I think too. Is you sign up for notifications, and then when the results come back, boom, right there.
Yeah, no, for appointments, it's completely invaluable because you can reschedule, cancel, set appointments as you go for all your different health checks and things that you may need. And it also gives you the ability to in-basket our physicians. So whoever your primary care physician is, or if you go and see a physician at a clinic for a particular purpose, you can actually in-basket them, send them a message if you have any questions on, you mentioned that I could do this drug or this drug, and there was some variance there. What was that? So you can point that out.
That's huge, because that becomes a primary communication between you and your doctor on a daily if you need to.
Right.
Because that's what I've noticed as I've used it. They will not communicate with the doctor, like to call and leave a message and get a message back. It's a 24-hour process. But I can send a message, and maybe the doctor, maybe his nurse, but you get a response right back. Here's what the chart says right away. Here's what you need to do. Yep. Or they'll send you a message of you need to get this done, which it really is. It's altered the way that, and we all use our phones every day, so this has altered the way that we communicate with our doctors.
And it's huge too, just as a patient, because sometimes you don't know, like, should I set an appointment for that? There's a particular thing that I have a question about, as it relates to me in my particular health issue. I don't know if I need to set an appointment for that. I don't even if I need to wait 3 weeks. So if I ask that question now, the physician very well may say, definitely set an appointment. We need to talk about that in person. But at least I mean, that helps. That helps tremendously.
So I'd change medications, and I started having, I guess, a reaction. So I messaged my doctor. I'm like, hey, I read that this is a possible reaction. I'm on this drug. Is this? So he replied right back with, well, do you have a fever? Are you seeing this? Are you seeing this? And I was like, well, no, I'm not seeing any of that. He goes, okay, then don't worry about that. You're fine. But it was funny because that's something I would have worried about and scheduled an appointment about, but was resolved in a matter of like 5-6 minutes,
right? Which
is huge.
I mean, peace of mind is invaluable.
So also we talked about notes. So the doctor's notes. I know I'll go to a doctor, and the doctor gives me a list of things to talk about or next things to do, and I'll talk to my wife, and she'll, what did he say? And I'm like, I'm trying to remember everything he said. But so the notes are in there.
Yeah, I mean your whole treatment plan is in there. So if you get 2 medications prescribed and you're supposed to diet and exercise, a particular way, all of that is transcribed into your medical record and therefore available in your MyChart. So all the notes, your full treatment plan, everything that you need to know about like how to keep yourself healthy is going to be in that MyChart. Yeah. And that's also huge. So we mentioned, being a caregiver of kids. So you can see that, like for my kids, I'm able to see, okay, my daughter needed that particular antibiotic for this, length of time or whatever the case may be. But if you're caring for like elderly parents or grandparents, it's even more so, because a lot of times, or sometimes, they may forget or may not remember what medications they're supposed to be taking, or that they're supposed to get up and stand and walk for every hour on the hour or something like that. So as a caregiver of one of those elderly adults, it's massively important to be able to have all that organized and laid out for you to say, okay, Grandma, it's time to walk. Let's take a walk around the block. Doctor's orders.
Yeah, so we saw that my father-in-law, my wife, amazing. She takes care of our children as well as her father, and it's funny because MyChart's really enabled her to do that. I don't know what we do without it.
Yeah.
Because she can see the notes, she can see what medication is on, she can go over there and look, and okay, well this medication's almost out. We need to. So it's been really nice just to be able to look at that in one place, and at the same time, only go check on what's going on with their little one. So it's just everything is in one spot with the MyChart.
Yeah, it's amazing.
Because I think a lot of times you'll see multiple apps. So you'll see one app for this, another app for this. I think the ability for Epic to put all that into one app, and it's really not overwhelming. It's pretty easy to use and very just easy to navigate.
Yeah, it's extremely intuitive. It's just like, if I were to make a comparison, it's just like using like a banking application or something on your phone. Everybody's pretty used to, okay, this is how I do transfers, this is how to do. It's laid out very similarly, and to your point, it aggregates all of that data down to one place and one application. Because yes, I've seen the exact same thing where you've got prescriptions in one app, and then you've got labs in another app, and you've got to go to all these different places. It's all in one place with MyChart, so that is very huge.
I guess initially when apps first started coming out, you'd see, okay, this specific app does one function, and when they started bringing apps together, they got very overwhelming quickly.
Yeah.
And this app, I guess it could have been, look at MyChart, it could have been just a web-based page that I don't know if it started that way or not, but what they have now is really an outstanding app that's very navigable.
Yeah, it's amazing. They take feedback too, so if anybody ever has any particular issue or anything like that, they make it very easy to reach out and say, hey, I wasn't able to schedule this appointment because of this, or I got this error, or whatever the case may be. And they're very quick to react to that feedback. So I think that's probably why the app is as good as it is.
It's probably agile development where they immediately see a problem, have something out in a couple weeks.
Rather than waterfall. yeah, it's great.
All right, so let's go into Hugs. So what is Hugs?
Yeah, so Hugs is our system for infant theft protection or prevention. Which is a weird thing to talk about, but it is a thing, unfortunately, that occurs. There could be a disgruntled parent, or there could be somebody that maybe just really wants a child really, really bad, and somehow finds their way into a hospital and tries to steal a baby. Well, the Hug system is actually pretty sophisticated. It uses triangulation between our access points, our wireless access points, to pinpoint exactly where a baby's at, and it's a bracelet that they wear on their ankle, or anklet that they wear. That talks to those APs and triangulates the location on a consistent basis, very, very quick frequency. And what happens is they set guardrails effectively, or like digital guardrails, invisible lines around where that baby can go. while it's in the care of
Where it's
the
expected
hospital.
where it's expected to be. Sure.
Right. You know, in mom's room or in the nursery, or but if it goes anywhere beyond that, immediately throws alarms, immediately actually locks down the elevator, so the elevator can't go up and down, and then immediately locks doors in the perimeter to prevent the baby from leaving. So that's
great. So how long has this been around?
That's actually been around for a while, and we're going through the process of a system upgrade, which is super fun.
We just put access points in. We're replacing older ones that were out of date, and that's what we were looking at. So you can now track Bluetooth where people are, where their phone is, what room they're in. So we can really have that ability. I was like, man, what's that useful for? Like here you go, it's perfect use.
Yeah, it's pretty fantastic. It is unfortunate that we have to have something like that, but I'm so glad that we do, because you can throw as many people at a problem as you want, and sometimes that problem will still exist and perpetuate. But when you get technology involved like that and make it so that it's autonomous and make it so that it really doesn't have any gaps that people can get through, I mean, that's huge.
So was there anything else you had to do? Say upgrade the access points for this? Were there any other changes or things you had to make, or was that really it?
It was pretty much the access points. So they did move from kind of a repeater model where they had a little bit of tech that would sit down in a power outlet, and would kind of repeat those signals across. So we get to remove those and rely solely on the AP technology. So that was a huge benefit.
So the access points will be tied directly into a wire, so that's probably a little more reliable than the repeaters?
Exactly, yeah. It's weird to think about wireless technology being more reliable because it's wired versus that's truly wireless technology.
So we got a broadband project going on, and it's funny talking to people. I said, well, we need fiber. Well, I've got cell towers. I'm like, well, the cell towers are all connected by fiber.
Right.
The fiber is needed for the wireless cellular communication. When you start talking about how wireless is heavily dependent on the wires,
right.
It's a very funny concept that just because you don't think about until you get in the middle of it.
Yeah. No, it's a similar concept to the cloud is just in someone else's data center.
Yeah, it is. We have servers here, and everything's virtualized. And one of my guys always says, "Well, this is our cloud." I'm like, you're right. There's a little bit more to it, but yeah, you're right. This is.
Yeah.
So, well, Jordan, thanks for coming on. Thanks for joining us, and thank you guys for watching. Join us again next time on Tammany Tech 101.